Andrew, are we ready?
Mr. Chairman, we are ready to go.
Okay. Well, I'll call the meeting back to order. We do have 3 items remaining on the agenda for today. The first item that we're going to be dealing with is item number 13. This is County Cares fighting for our frontline and essential workers. This item was brought forward by Supervisor Nathan Fletcher, so I'll allow Supervisor Fletcher to say a few introductory comments, and then we will get to the public testimony on this item.
Thank you, Mr. Chair. During this global pandemic and crisis we've seen, despite all the difficulty, have seen heroic efforts made by our essential workers. They have stepped up during a time of difficulty to leave their houses, oftentimes not only to leave their houses, but to directly engage and provide treatment and assistance to individuals who are COVID-19 positive or persons under investigation. In a time when we've asked the broader public to stay home in order to protect themselves, essential workers have been asked to go to work and continue to go to work despite the dangers that they face, both to their own health and safety, but to that of their families when they were exposed. As a Marine who served in the Marine Corps, when we were sent into combat or into harm's way, we were appropriated combat pay as an additional add-on to our normal to reflect the additional danger that was faced beyond what was normal. And so I think that it is appropriate that we take consideration of hazard pay for our county workers. These are our county workers who are on the front lines, who are not only leaving their homes, but putting themselves at risk and in danger. It is also, I think, an easier conversation to have now because of the more than $300 million in federal CARES Act funding that has been allocated, funding that is entirely appropriate and okay to be used to modestly compensate our workers for the dangers that they face. We've seen a number of counties around California who have taken some action: Alpine, Humboldt, Marin, Merced, San Francisco, San Joaquin, Tehama, and other counties that have taken some steps to try and recognize the sacrifice and the danger these workers are facing. And so our action today is to ask the Chief Administrative Officer to work with the county collective bargaining units to assess which job classifications of essential workers would fit in each of the tiers we're proposing, then to do an analysis of the cost and bring that back to our board for consideration of hazard pay. And the framework that is being proposed is Tier 1, recognizing those workers who face the greatest danger and greater hazard, a 5% salary increase for county employees who work directly with COVID positive individuals or persons under investigation. This would continue either for the duration of the public health crisis or until the end of the calendar year, whichever came first. Tier 2 would be a 3% salary increase for county employees who not only continue to come to work, but engage directly with the public, with members of the public through their regular job. Tier 3 is a 2% salary increase for county employees who are required to report to work and are exposed to their coworkers. And then for our county workers who are telecommuting, the ability to submit specific expenses, work-related expenses, capped at a maximum of $100 a month of things, the expenses they have incurred directly tied to their job and having to do their job from home. And again, to pay for this, we are proposing using the CARES Act funding. San Diego County has received $334 million. This would be a fraction of what we have received in order to provide our workers who are on the front lines little help and assistance during this difficult time. So again, today's action is just directing the Chief Administrative Officer to work with the bargaining units to assess how many of our essential workers would fit into each of those 3 tiers, to do a fiscal analysis of what that cost would be, and then bring it back to our board for consideration. And with that, I would make a motion to approve.
Okay, is there a second to that motion? Okay, we do have a number of people who want to speak to this item. I would suggest we go ahead and hear those speakers.
Chairman, can I ask, Chairman, I'm sorry to interrupt. Am I able to ask
Yes.
a preliminary question of our CAO?
Sure, go ahead.
Thank you. I'm interested in knowing how many county employees have contracted COVID-19 and also how many have contracted it at the workplace. And then secondarily, I have a question about our projections on the impacts of our response. I understand we've been given $334 million in the CARES Act, but I'm interested in knowing how much you project our overall response will cost, with the understanding that it's approximately 20 million per month right now.
Would the CAO like to respond?
Sure. Mr. Chairman and Supervisor Gaspar, we currently have 20 employees out of the 18,000 that have tested positive for COVID. So my math, I think that's about 0.1%. So I think that answers question number one. Question number two on the CARES Act, what we think we're going to spend. In the presentation this morning, we had these 6 different areas. Some of that is obviously policy decisions that will be made. Some of that is unknown based on the length and duration of the actual COVID response. And then how much testing will cost is an estimate at this point. But if you added up those 6 buckets, it was $525 million, of which we have $334 million in CARES Act funding. We do not know yet if there will be a 4th stimulus package. If there is, then we certainly have been advocating for that. And we potentially, and I say potentially, could receive something from the 4th stimulus package. But at this point, a 4th stimulus package is a long way off. Thank you.
And then also, Helen, thank you very much for that response. In the tracing of the COVID-19 cases for county employees, do we know how many contracted COVID-19 in the workplace?
Supervisor Gaspar, in the tracing at this point, none have been identified as tracking back to receive or getting the infection from the work environment. Of course, no one ever knows how you got it or when you got it, but through the tracing, it has not been identified as directly related to the work performed by any county employee at this point.
Thank you. Thank you.
Okay, I know we have a group presentation, and then I'm not exactly sure how many individual speakers, but I'll ask Andrew to go ahead and time the group presentation. We'll limit that to 10 minutes, and then if there are individual speakers, we'll limit that to 2 minutes each. And again, we would remind people, if they wish to speak on this item, they do need to call in on or dial in on the conference line now for this item, which is item number 13. And then you'll be put on mute until it's time for you to speak. So Andrew, if you go ahead and call it the group presentation.
Thank you, Mr. Chairman. I'll also note that we received 3 e-comments on this item. We had 11 requests to speak on this item. We have a number of speakers on the call, and we'll start, as the chairman indicated, with the group presentation. We'll give 10 minutes for that item, and each speaker, please state your name for the record. We'll begin with the first speaker.
Thank you. The first speaker from the group is David Garcias.
Thank you, Mr. Chair, members of the board, Madam CAO. So I'm David Garcias. I'm president of SEIU Local 221. We have submitted a video to the clerk, so we please ask that you play the video at the end of my comments, and the rest of our speakers will speak after the video. Our members work directly with patients that have COVID-19, and these members have contracted the virus. I disagree with the CAO. We believe we have had workers that have contracted from clients of the county. With the board, Supervisor Roberts, Supervisor Horn, Supervisor Pam Slater-Price are no longer here. The former CAO, Walt Eckert, isn't here, but the culture of the legacy of this board is still here. During the Great Recession, when people were suffering throughout San Diego County, it wasn't the time to invest in employees or the community. In fact, it was time to put money into the reserves. When the economy improved, it wasn't the time to bring our employees from the bottom rate of California. It was time to invest in reserves and keep staffing at minimum levels. Now, it's almost like there is never a good time for the Legacy Board to actually support and invest their workforce, the employees of the county. It's about choices. And I know Supervisor Gaspar said how much money are we going to have and where's it going to go? It's a choice. You make a choice to put money and invest in your workforce. Change is coming to the county next year, whether you like it or not, and the legacy of this board is already written. The board cared about their credit rating and their reserves more than their workforce and their community. And as I speak for these 10,000 county workers, I'm speaking to tell you they are tired and they need your support. But the good news is that you have an opportunity to change this legacy. You have $330 million federal dollars that even your own staff has said can go to hazard pay, that can be invested in the workforce on the front line of the COVID response. Today is the day you can take a step forward and vote for employees, your workforce, and show them that when it mattered the most, you are willing to step up for your workforce. I hope you listen to the voices in the video and your comments, and please vote yes. Thank you. You can please play the video.
Thank you. We'll queue up the video now, and then after the video, we have a couple other members of the group.
Thank you.
Hello, my name is Juan Carlos Davenport, and I am a records clerk for the San Diego County Probation Department. We give people a second chance, and we protect communities.
My name is Drusilla Willis, and I am a Human Service Specialist with the Lemon Grove Family Resource Center. My job as a Human Service Specialist is to help our clients get back on their feet.
Hi, my name is George Morris. I'm a park ranger with the County of San Diego Park and Rec. We proudly maintain county facilities and properties and also resources. Our main goal is to ensure that residents and visitors alike are able to enjoy the resources that we have.
My name is Nick Soriano with the County of San Diego Vector Control Program. I'm a vector control technician. We protect the public by providing control and preventing the spread of vector-borne diseases such as Zika and West Nile virus.
My name is Rachel Randolph, and I'm a residential care worker supervisor at Polensky's Children's Center, and it is my job to keep the children safe.
My name is Amanda DeHart, and I'm a psychiatric registered nurse. We are caring for mental health patients at the San Diego County Psychiatric Hospital.
My name is Leslie Massland, and I'm a librarian. We provide access to educational and job training resources for the most impacted groups.
My name is Robin Booker. I'm a senior cook with the Sheriff's Department. We are food service and we are important. We feed our fellow staff and sworn staff, as well as up to 6,000 inmates 3 times a day.
Hello, my name is Monica Ferroni-Sakasagal. I'm a pharmacist with San Diego Psychiatric Hospital. We care for the sick. We take in a lot of the 5150s in the county, and we are 24-hour, 7 days a week essential hospital that services the entire county unfunded.
As we serve our communities, we are all essential.
And safety for us, for our frontline workers, is essential. Because if we are not safe, we cannot keep you and our community safe. Everyone should be safe.
Everyone should be safe.
Everyone should be safe.
As we serve our communities, all we ask is that you protect us and our families.
That includes items like personal protective equipment and hazard pay.
PPE, protective equipment, and hazard pay.
Personal protective equipment and hazard pay.
Everyone deserves financial security during this time,
especially those working on the front line.
That is why we are speaking out.
And that's why we're speaking out.
That's why we are speaking out.
For frontline workers and for your safety.
Which means protecting our safety.
Do the right thing. Protect all workers.
Which means respect for the hard work that we do.
Protect all workers.
Protect us.
Protect our communities.
Protect everyone.
Invest in San Diego families.
Thank you. We'll move on to the next member of the group, 6687.
And for the benefit of the members of the group, you have 3 minutes and 30 seconds remaining.
All right. My name is Drusilla Willis, and I'm a human service specialist at the Lemon Grove Family Resource Center. I am proud to be a member of SEIU Local 51. First, I would like to thank you guys for all that you have done so far, but there is still more to do. I am here to ask the board to vote yes on the hazard pay for county employees. You have heard from us again and again on this issue, and today is the day to take action. Many employers in the region are stepping up to support their employers, serving the community during this pandemic, and we are asking that the county do the same. We are your employees. We are helping to make San Diego County handling of this pandemic a success. In the beginning of this pandemic, we were all running around, not knowing what to do. No one knew what to do. Whatever you asked of us, we did. Even when instructions of the handling of this pandemic changed sometimes 2 and 3 times a day. Let's face it, we have the money. The county has gotten $330 million from the federal government, and more is expected to come to support San Diego County. We are the county. Your employees are the county. Me, you, the Board of Supervisors. So invest in us by supporting us in the passing of this hazard pay initiative. We all know that the county has reserves that can be used, please. So please invest in your employees. I would like to finish with a quote by the Reverend Martin Luther King, and that is, "The time is always right to do what is right." So I'm asking you guys to please do what is right and support your employees today. Thank you.
Thank you. And the last speaker in the group is 9702.
My name is Avery Ware. I work at Adult Protective Services. I'm proud to be a member of Local 221 and the Invest in San Diego Families Coalition. And I'm here to ask the board to vote yes on hazard pay for county employees, something that employees have been highlighting with regard to the unsafe conditions, including lack of PPE and hazard pay for more than a month. Many non-healthcare workers are providing essential services to members of the public on a regular basis, despite our ongoing concerns that we're risking exposure to COVID-19 without enough PPE. Some workers, such as protective services workers, have to at times conduct home visits where social distancing is almost impossible. And we have to do that with one mask provided to us by the county that we need to reuse several times. Other workers, like food service workers, are in detention facilities serving food to inmate populations with a cloth mask covering. The need for adequate PPE and safety protocols extends beyond healthcare workers, and we filed numerous complaints with Cal OSHA about these on Friday and released a report on April 6th highlighting the risk for frontline healthcare personnel and nurses. Many public and private employees are providing hazard pay. We represent also in our union workers at the San Diego Housing Commission who agreed to a 10% differential for working in person, and those who interact in close quarters with clients receive 20%.
Sir, I'm going to ask you to
Home
please
Depot,
summarize your comments.
Okay. We need to assess budget impacts in the future, but CARES money is for pandemic response now. The county also has $2 billion in reserves for emergencies, and it's time for the board to measure its success on how it supports its workforce and community. The AAA credit rating is not an end in itself, a means to an end, as that's what it should be. We urge the board to vote yes to support hazard pay for its employees.
Thank you. Our next speaker is 3634.
Good afternoon, Chairman Cox, members of the Board of Supervisors. My name is Nora Vargas. I currently serve as the president of the Southwestern College Governing Board, and I'm a proud resident of District 1. I wanted to first thank the board and all of our county staff for your rapid response to COVID-19 and taking the necessary measures to limit public exposure and helping flatten the curve, ensuring that the well-being and safety of our community. I really am calling in today to support this item in the interest of promoting public health and safety of our county workers that have been on the front lines. Yesterday, I had the pleasure of joining the members of SEIU 221 in a caravan rally in support of our frontline workers and highlighting this important action. Our San Diego County employees have stepped up during these unprecedented times, and their health, safety, and economic well-being must be a priority. Now more than ever, we must stand together to ensure county staff is compensated equitably and protected. I want to express my full support to ensure employees have access to personal protective equipment, hazard pay, and support for COVID-19 negotiations for our county employees in light of the recent public crisis we are facing due to the pandemic. I also want to support Supervisor Fletcher's recommendation of allocating $5 million of County San Diego CARES Act funds to support emergency childcare vouchers for essential workers and vulnerable populations. Budgets are but a reflection of our values and our priorities. We can be fiscally prudent and do the right thing by our frontline workers. Today, we have an opportunity to step up and recognize the work our county employees do every day to keep our county running and move our region forward. I respectfully urge all of you to support this item. Thank you.
Thank you. Our next speaker is 2799. 2799, you may please state your name, and then you have 2 minutes to address the board. It looks like you may be on mute on your end because we see you trying to talk. So we will give you a minute and we'll go on to the next speaker and come back to you. 7610. Let's see here. 7610.
Yes, good afternoon, Supervisors and CAO. Paola Martinez Montes on behalf of the Invest in San Diego Families Coalition. I'm here to ask the board to vote yes on hazard pay for county employees. We're grateful to county employees for serving on the front line, to our nurses who are caring for COVID-19 patients and social workers who are keeping our children safe. All of these public servants are working to slow down COVID-19 infections and are putting themselves and their families at risk. We've heard too many stories about how these employees don't have the proper equipment to stay safe, and we need county employees to be safe and protected so that they can continue to protect our community. We know that there's $330 million in CARES Act money, and are supporting workers that are helping us to bend the curve, and in supporting workers that are helping us to bend the curves to support workers that are helping us to bend the curve is a very definition of investing and addressing this crisis. Please vote yes on this item. Thank you.
Thank you. Our next speaker is 2799.
Yes, I'm here. Hello?
Hi there, we can hear you. Could you please state your name for the record?
Okay, thank you. My name is Scott Laudner, and I'm the president of the Probation Officers Association. And our officers have taken an oath to protect and serve our community. Even through this pandemic, our officers continue to come into work every single day, working with clients in the community, in the office, and in our institutions. We're even traveling around the country doing transportations and extraditions. This is opening up our officers and their families to considerable risk to obtain the virus. Our daily duty expectations have grown and require staff to work in work locations and perform duties that are not their normal duties. This pandemic has caused severe financial hardship for many of our officers in the declining total family income and growing childcare costs. They are stepping up as professionals and performing all of our duties and requirements with honor and integrity to the oath that they have taken. I'd like to thank Supervisor Fletcher for bringing this proposal forward, and I'm asking for the entire board to please consider this and protect our officers and do what's right by our officers and consider adopting this amendment. Thank you.
Thank you. Our next speaker is 9997.
Good afternoon, Supervisors. This is Roberto Alcantar with the Chicano Federation of San Diego County, and also very proud members of the Invest in San Diego Families Coalition. We just want to strongly urge you to please support our county workers. These are the essential workers that are on the front lines, putting themselves in risk way to really help out the families that we also serve. And we've seen the impact of having these programs continue to operate and being able to serve the families that we serve. So we want to thank you for that good work. But we know that our county workers are in dire need. They're facing unprecedented challenges. So we're here in support of our county workers and strongly urge you to provide this hazard pay. Thank you.
Thank you. Our next speaker is 2009.
Hi, this is Kathy Griffey. Good afternoon, Chair Cox and members of the board. I am a nursing supervisor at California Children's Services, and I'm proud to have worked for the county for 28 years. And like so many other healthcare workers, I am dedicated my life to serving our community. Today, I'm speaking on behalf of all essential workers, especially healthcare and nursing staff on the front lines of the fight against COVID-19. These workers are risking their lives for our community, and they need your support as elected officials. They need personal protective equipment and hazard pay. Public health nurses work in a wide variety of environments that bring them into contact with COVID-19 positive individuals and persons under investigation. During this emergency, they are treating and caring for the sick at the convention center, homeless shelters, and hotels. At the county psychiatric hospital, where nurses help people struggling with mental illness, staff have tested positive for COVID-19. In detention facilities run by the sheriff's department, staff have also tested positive. Jails are dense environments with constantly changing populations of people, including staff who work in multiple facilities. Nurses who care for inmates and detainees always a dangerous job, but COVID-19 has taken it to a new level. These nurses have not been provided with adequate PPE. Instead, are being required to use N95 respirators repeatedly and keep them in brown paper bags. At Edgemore skilled nursing facility, staff did not receive their PPE quickly enough, and with multiple delays in getting them fitted for N95, staff have also tested positive for COVID at Edgemore. This is a facility where frail and elderly people are cared for. The county cannot afford delays here. It's a liability to public health and on so many other levels. This situation is making our already unsafe staffing levels even more difficult to survive with. In addition to providing PPE with these, we are calling on the county to fully staff medical and mental health services in the county jail. RNs, LVNs, CNAs, and others will continue to rise up to this challenge and to serve our community. As healthcare professionals, we have a responsibility to serve those as elected leaders. So do you.
Ma'am, I'm going to ask you to please summarize your comments.
I urge you to do the right thing and vote to support hazard pay for the frontline workers. Thank you.
Thank you. And our final potential speaker on this item is last four digits 6020. If you'd like to speak on item 13, please state your name for the record.
Hello?
Hi there. Did you call in for item number 13?
Yes. My name is Michael Boyer. I've been a mental health clinician for the Sheriff's Department for the past 6 years. My coworkers and I work in a high-stress environment on a regular basis. When the COVID-19 outbreak began, my coworkers and I had to continue to work amongst the uncertainty, while many county workers were working from home. This has caused a tremendous amount of stress for my coworkers and I, not only in a work environment, but our professional lives as well. Every day we have to think about possibly exposing our loved ones to COVID-19. The union proposed to have our pay doubled, and we're told that this is unreasonable. Is it unreasonable to put a dollar figure on the health lives of county workers? If we are continuing to put ourselves in hazardous situations, is it unreasonable to ask for hazard pay? Is it reasonable to think that a regular email from the county supervisor is sufficient compensation for the risks we take on a daily basis? Since I started working for the county, it seemed that integrity and respect were core values. It does not feel that way right now. All we ask is that those in power do the right thing and compensate workers for the risks that we take. Can it honestly and with integrity be said that this is an unreasonable request? Thank you for your time.
Thank you. And that concludes public testimony on this item, Chairman Cox.
Okay, we'll come back. And again, Supervisor Fletcher, I'll allow you to say anything else you want to say, and we'll see if there's a second to the motion.
I believe this is a very modest and reasonable effort to recognize our frontline workers, our first responders, our public health nurses. And again, the availability of Federal CARES Act funding, I think, puts us in a position to be able to make this modest contribution and recognition of our frontline workers, and would request everyone's support.
Okay, and you were making a motion?
Yes, made a motion.
Okay, is there a second to that motion?
No, but I'd like to make a comment, Mr. Chair Cox.
Super. Vice Chair Desmond.
Thank you very much. You know, health and safety of our employees is always number one. I mean, we have to, you know, that's always been forefront of our minds. And, you know, in the times that this virus has hit us. It's affecting the county in many, many ways. And we appreciate, the frontline workers. I mean, you're doing God's work. You're the angels in the community out there, taking risks that we all appreciate. The 334 million is a lot of money, but we actually have over 500 million in costs so far. So there's already a gap there. And out of that 334 million, we got 17 cities that are all going to want a piece of that as well. So, our number one priority is to stop the virus. And I think our second priority, when it comes to money, it's all about prioritization. Not that our employees aren't the highest priority. Your health and safety is, and I think we're providing that. But secondly, I think we need to open up our economy and reduce the 25% of the workers out there right now that aren't getting a paycheck at all. There's over 25% unemployment rate. We really need to kind of focus our efforts to get them back to work. And quite frankly, in the long run, they're the ones that are paying your salaries. So we need to get that group back to work as soon as possible. And I just can't conscientiously vote for a raise for people, even though they're deserving and you're deserving. I can't consciously vote for a raise when other people are completely out of work. So thank you.
Okay, are there any other comments? I would just offer a couple of comments. We have 18,000 employees in the county of San Diego, and I have a great deal of respect and admiration for all of them. But the reality is we've got so many unknowns, and while we have some employees that are in a situation where they may come in contact with COVID-19 individuals, we do not operate an acute care hospital, so we don't have anybody providing direct services to COVID patients. We've been very fair, I think, to our employees. We've provided 120 hours of banked sick leave to all of the employees. We have not laid off or put anybody on furlough at a time when Supervisor Desmond said we've got 25 to 30% of the population unemployed. The fact that we have all of our county employees working, I think, is a credit to the county of San Diego. And while we have had a AAA bond rating, I suspect that that's going to disappear very quickly with all of the demands that's going to be drawn on all the costs associated with responding to the COVID-19 crisis that we're dealing with. We're going to have some tough decisions to make in the next fiscal year. I suspect we're going to have a smaller workforce next year. We've seen significant revenue drops in Prop 172 funds and other funding streams. Our pension costs, because of the loss in the invested pension funds over the last 7 weeks, is very dramatic, and it means we're going to have to pay more into the pension fund. So there's a lot of unknowns out there, and regrettably, I can't support this motion, at least at this time, and I think we've got to have a lot more answers before I'd ever want to consider taking a step like this. Now, I do think we have an obligation, and we've had the same problem other jurisdictions have had in getting the PPEs, the personal protective equipment, although I think that's changing very quickly. I know we've got some major orders in for N95 masks and gowns, all the other things that should be available. And I have no question that that's going to be taken care of in the next week or so. So I regrettably can't support this item at this time. Any other comments from board members? Okay, if not, we'll move then on to item number 15. Item 15 is supporting emergency childcare vouchers for COVID-19 essential workers and other vulnerable populations. And this also was brought forward by Supervisor Nathan Fletcher. Supervisor.
Thank you, Mr. Chair. Healthcare workers, first responders, employees of essential businesses are working daily to service and protect us. They are having to pay for childcare because children are not in school because we closed schools due to the COVID-19 pandemic. If you count the school day as well as before and after care programs, this often adds up to 50 hours a week of child supervision per child that has unexpectedly disappeared. Having to shoulder this hefty new cost can be harsh on a family's budget and adds to the stress of an already hectic situation if you are an essential worker during this crisis. And oftentimes families maybe relied on a grandparent or some other family member who watched their kids before or after school, but are now unable to do that because of the risk COVID-19 poses for older adults. The proposal we've brought forward, represented here in Agenda Item 15, requests your support to allocate $5 million of County of San Diego CARES Act funding to support emergency child care vouchers for essential workers and vulnerable populations. To carry out this proposal, I am suggesting that we partner with the YMCA Child Resource Services and Child Development Associates to administer the funds. These two entities have experience locally distributing child care vouchers through an existing contract with the state child care voucher program for low-income workers, which was recently extended to COVID-19 essential workers by the governor in April. By joining into an existing program, we'll be leveraging the system infrastructure and the operators, having the YMCA and CDA administer the program using similar family eligibility and prioritization criteria that are already in place, rates and other program guidelines detailed in the California Department of Education Early Childhood Learning and Education Division Management Bulletin, which is issued when the program expanded eligibility and funding to COVID-19 essential workers. In this proposal, child care vouchers will remain available to San Diegans until the funds are fully exhausted or by December 30th, 2020, whichever comes first. The need continues to be great, and new funding since the COVID crisis is drying up as quickly as it is made available, and there are many being put on waiting lists for vouchers. This includes the $5.1 million that the governor allocated to this program. 1 week ago, local child care voucher applicants opened up due to the new state money, and the fund is already exhausted and new applications are closed. Over the past week, 1,514 families with 97% representing essential workers and 3% representing at-risk families per the eligibility criteria outlined in this board letter were not able to achieve services. Some of you may be aware that COVID Children's Fund supported by the philanthropy and provides one-time micro grants to San Diego families struggling. This fund, separate from the one we're talking about today, is also exhausted and has a wait list. To further convey the real struggles that families are grappling with, I would like to, in a moment, show a brief video testimony of individuals explaining their current circumstances and how the utilization of $5 million in federal CARES Act money can help our region get through this. Before we get to that, I would just like to say a special thank you to all of the groups that have been instrumental in supporting this effort and helping us craft it and shape it. That includes CAL FIRE, San Diego County Firefighters, Local 2881, San Diego City Firefighters, Local 145, the YMCA Downtown Partnership, SEIU, UHW, UDW, San Diegans for Every Child, and a wide variety of additional folks who have joined us in supporting this program and would request your consideration for support. With that, if we could show the video.
I have been having a lot of childcare struggles. I've exhausted my efforts to try and find childcare. A lot of people are quarantined. We usually use family and friends, but they are not allowed to leave their houses at this time. We are limited on resources. We are frustrated. We are nervous about our financial situation. And we currently have no options for us at this point.
We have two daughters, and they are 8 and 9. And the school closures have had a huge impact on our lives. It's a huge financial burden because we're looking for someone to not just babysit, but also to help with schoolwork and spend large chunks of time with our kids. And so it's unfortunately added a lot of stress to our lives during an already stressful time. If there was any assistance with that, that would be huge. That would be a huge relief for our family in in trying to kind of navigate this crazy time.
My husband and I have been greatly affected. We both work for the same police department. We have 3 children together, ages 7, 5, and 1. Before the closures, obviously, the 7 and the 5-year-old went to school, and my mother, who is 72, would assist us with childcare during the day for my 1-year-old. Then the closures happened, so we had nowhere for them to go, and obviously with the recommendation of elders to shelter in place, that left us with my mom no longer available to help us either. With the thought of having to pay for childcare for 3 children is a huge financial burden for us. Especially with 1-year-old in diapers, they're more expensive. So it's been trying for us to have to think about paying for 3 children.
I have 2 kids. I'm a single father. One's 11, one is 14. You would think that that'd be easy for them to watch each other, but that's not true. I've been paying my niece, who is 17 years old, to watch my kids about $100 a week. Not to mention, I start work at 7. I got to get up about 5 in the morning, drive over to Oceanside, go pick up my niece to bring her back to my house. There are days that I don't even get home until 8 o'clock at night, and I've had a 17-year-old watching 2 kids for that amount of time. $100 a week doesn't even justify what she should be paid, nor what a teacher would be paid for a salary for each week. It's extremely stressful to go to work and focus on taking care of others when you are limited on taking care of your own family. It's very, very excruciating to be at home and receiving phone calls multiple times, interrupting your day, text messages, you're not focused. We just need the help.
Thank you, Mr. Chair. With that, I would make a motion for approval of item 15.
Okay, I would second the motion. We do have a number of people that want to speak in this item, so I would ask the clerk to start queuing up those people. And again, if you do wish to speak on item number 15, we would ask that you please dial in the conference line number, which is have been provided to you as far as the instructions, and you'll be muted until it's time for you to speak. Mr. Clerk, would you go ahead and call up the first speaker?
Thank you, Mr. Chairman. I'll also note for the record that we received 14 e-comments on this item. We have about 14 callers on the line to address the board, and as a reminder for the callers, if you do not wish to speak on this item, hang up and call back when the board begins discussion of the next item. We'll be calling speakers by the last 4 digits of their phone numbers. You'll hear notification that your call has been unmuted, and each caller will be asked to state their name for the record, and you'll have 2 minutes to address the board. I would remind the speakers they should mute their TV or live video stream before they begin speaking. I'll turn it over to Aaron to identify the first caller.
Thank you. Our first caller is 1939.
Hi there. My name is Joe Jacobson, and I'm a regional political organizer with SEIU United Healthcare Workers. I want to thank the board for considering this proposal and for caring about our members. I also want to thank the SD Police Officers Association for their support as well. In order to reopen the economy, as many of you have already touched on, hospitals must be fully prepared for a surge in COVID-19 cases. A primary way to deal with this surge is to make sure all workers have affordable childcare so they can come to work. If a healthcare worker does not have any childcare options because schools are closed, they have to make the impossible choice between saving lives and leaving their kids home alone. When we reopen the economy, we want essential workers staying on the front lines, not being forced to stay at home because they can't pay thousands of dollars a month for childcare. Our members are working people who make $16, $17, $18 an hour. They can't afford thousands of dollars a month for childcare. $5 million out of the $335 million that San Diego County received from the CARES Act is a very small amount, but it will make a big difference. The $5 million that San Diego County was already given for childcare by the state of California ran out in less than 1 week. Essential workers across the county will quickly use the thousands of slots you provide. To reopen the economy and allow essential workers to remain on the front lines, I urge you all to vote yes on this proposal.
Thank you. Our next speaker is 4716.
My name is Molly Woodstrake. I'm the union representative at Tri-City Medical Center for 963 SEIU United Healthcare Workers. For the last 6 years, I've had the privilege to work alongside some of the most selfless, caring, and hardworking healthcare workers in America. UHW members are certified nursing assistants, respiratory therapists, environmental service aides, emergency technicians, social workers, and dozens of other healthcare professions. These workers are risking their lives every day to keep us safe from COVID-19, and they're the lifeblood of Tri-City Medical Center. Due to COVID-19 and the necessary changes that have occurred as a result, including the closure of schools, I hear stories every day about the difficulties healthcare workers experience because they cannot afford childcare. UHW members are working people and paying thousands of dollars a month extra for childcare because schools are closed isn't an option. Jennifer, an emergency room registration clerk, has 2 kids under the age of 10. Her husband is a firefighter and is an essential worker as well. She regularly has to choose between using family medical leave and missing a day of work, or saving lives by admitting patients into the ER and leaving her kids with neighbors that she can hardly afford to pay. In all of my 10+ years serving working people, these last few months have been the most trying and difficult times for me as a representative of frontline caregivers. In many ways, I have become not only the union representative meant to enforce a collective bargaining agreement, but also a social worker listening to hospital workers cry, an unemployment expert, a PPE procurer, a sewer of handmade masks, and like you all, an advocate for those who we depend on to survive this pandemic. The term essential doesn't do justice to the frontline hospital workers who are protecting us all from COVID-19. I have submitted a letter from Tri-City CEO Stephen Dietland and another from Luz Leal, a CNA at Tri-City Medical Center, on how the San Diego County child care voucher she received has changed her life. I strongly urge the board to vote yes on the $5 million essential worker child care voucher plan so that healthcare workers do not have to continue to make the impossible choice between saving lives or taking care of their kids. Thank you for all you do.
Thank you. Our next speaker is 5427.
Hello, my name is Sophia Rodriguez, and I'm an HHS worker at Lemon Grove Family Resource Center, a proud member of SEIU 221, and part of the Invest in San Diego Families Coalition. Before I start, I want to thank the county supervisors for allowing me to speak today. I know all 5 of you are very busy in keeping San Diego up and running. I also want to give a shout out to Supervisor Greg Cox and his team for his commitment to District 1, where currently me, my husband, and my 2-year-old live. And where in the South Bay, there's a large number of positive COVID-19 cases. Although I am in support of the essential workers child care, I just want to make a note that I'm very disappointed in the previous item that no one seconded Supervisor Nathan Fletcher's motion for hazard pay or items for PPE. I'm very disappointed. Both me and my husband are essential workers at this time. And if we are summoned to work, we have no one available to take care of our 2-year-old. We are crossing our fingers every day that both of us do not get summoned at the same time, seeing as how all childcare in our area is closed and all of the available relatives are at risk for contracted COVID-19 due to prior health issues or a susceptibility to respiratory issues. I would like to second all that was mentioned prior that spoke before me, and I hope that the Board of Supervisors can at least support children in San Diego before reopening the economy, businesses, or make any attempts to move forward and making what used to be normal. I hope the board does the right choice and support our children in San Diego. Thank you.
Thank you. Our next speaker is 7273.
Hello, my name is Robin Layton, and I am the President and CEO of Educational Enrichment System and Pro Tem Senator Atkins' appointee to the statewide Governor's Early Childhood Policy Council. And I just want to reiterate how childcare is needed to get California back to work. Currently, my nonprofit is providing hands-on resources and supports during this time of closure for families. Our centers may not be physically open, but we are open for business just like the K-12 schools, thanks to continued funding from the Department of Education. However, this is not helping the essential workers that need childcare today, which is what this proposal before you today is. We are working with the state legislature on fiscal year 2021 recommendations. This proposal today is not about that. I want to be clear, this is completely separate, and I look forward to continuing early education conversations with you as we get California back to work when this crisis is over, using the existing mixed delivery system and current childcare providers and centers. I do have some data on the statewide funding that was given to San Diego County. That money has already run out, which is why we so desperately need the Board of Supervisors funding today as well. The average income of families, according to the data reported, shows that all families are low income. The average annual income of the families applying is $58,000. The income guidelines for our state-funded programs for low-income families is under $69,000 for a family of 3. So those applying need this emergency care, and they are low-income working families. Given this COVID-19 crisis, I urge you to vote yes to fund the $5 million for emergency childcare for our essential worker heroes. It is essential to reopening the economy as we all want. Thank you so much.
Thank you. Our next speaker is 7554.
Hi, good afternoon, and thank you to the San Diego County Board of Supervisors for this opportunity to speak. My name is Erin Hogeboom, and I'm Director of San Diego for Every Child. We are a countywide coalition of passionate San Diegans and organizations that are working to cut the experience of child poverty across San Diego County. Unfortunately, the COVID-19 crisis has exacerbated child poverty and has brought even more children and families into dire circumstance. On March 13th, the Friday before school closures, we stood up the San Diego COVID-19 Children's Fund. The first, most pressing issue the fund has worked to address is childcare for our essential workers. Given that nearly no family has the budget to absorb 30 plus hours weekly of additional care, and that our health and safety and economic recovery are so reliant on their continued courageous work. Thanks to the generosity of the philanthropic community, including aligned funds from the San Diego Foundation, we've raised nearly $1.2 million. Through the diligent administration of Child Development Associates and the YMCA Child Care Resource Service, over $515,000 have been allocated already to help families pay for child care and groceries. Meanwhile, over $200,000 has gone to our courageous child care provider community to help pay for operating costs, but the requests have now outpaced funds. At the same time, CDA and the YMCA have been administering CDE-funded emergency AP voucher program. The state's local contribution to child care covers roughly 2,600 children through May and June. In just 1 week of being open, that fund has nearly been exhausted and is now a waiting list. This isn't surprising given that the healthcare field alone represents approximately 40,000 workers with children under the age of 14. Important to note is the average annual income of families receiving that fund is $58,000, a full $20,000 below San Diego County's median household income of $79,000. The reality is that the current philanthropic and state funding are not enough on their own. I want to emphasize that as you discussed this morning with businesses opening and as schools remain closed, this issue becomes even more pertinent. No family should have to choose between caring. Please support the $5 million for child care for essential workers. Thank you for your time.
Thank you. Our next speaker is 8495. 8495, if you'd like to speak on item 15.
Hello. Hi, can you hear me?
Yes, you may proceed.
Hi, my name is Rahma Abdi. I am from San Diego. I'm an essential worker as a child care provider. I would like to please urge to vote in favor of the proposal for the San Diego County funding for child care vouchers to those at risk, and also the other essential workers. Please, County Supervisor, if you guys can vote for that child care essential worker voucher, please.
Thank you. Our next speaker is 8592.
Good afternoon, Board of Supervisors. My name is Joanna Puno Hester. I'm the Assistant Executive Director for the United Domestic Workers of America, AFSCME, Local 3930. We are a partner union of the Child Care Providers Union, CCPU, representing over 47,000 providers in the state of California. I want to commend Supervisor Fletcher for this proposal to allocate $5 million to fund an emergency child care voucher for COVID-19 essential workers and other vulnerable population. Through the advocacy work of CCPU with the state, we were able to win $50 million to fund child care vouchers for essential workers, but that only translates to 5.1 million, or approximately 2,600 slots for children. And that's just simply not enough slots. We have the responsibility to take care of those who keep us safe and by providing quality childcare for our essential workers. And so I am in absolute support of this proposal. As a complement to this proposal, when essential workers begin to search for family childcare providers, we offer a parent portal available to all essential workers called Karina Care that has been endorsed by the state of California. And I will be more than happy to share information on this web-based app today. By helping connect essential workers to family childcare providers, we can help keep these home-based micro businesses keep their doors open, and in return, a win-win for all. Please support this proposal. Thank you.
Thank you. Our next speaker is 9349.
Hello, this is Julie Lowen. I'm the president and CEO of Children's Paradise. I'm grateful to the Board of Supervisors today for considering funding childcare. I, however, do not support voucher funding for over-income families. The capacity of childcare to serve these potential new families is reduced by 60%, as the capacity of childcare under the current 2 teachers per every group of 10 has been reduced and is structurally unsustainable. Adding families without simultaneously supporting our capacity to provide care simply complicates the current child care crisis. Thousands of funded spaces across this county are currently closed. A better option is to reopen these already funded spaces without delay. Today, a list of CARES funding investments were presented with many useless spending ideas. Children and families were not listed as a priority anywhere within these investment options. The essential workers who care for San Diego's children every day were also completely missing from the list. There is no better investment than to engage existing child care centers to support the reopening of our economy. We are profoundly effective community resources. Our teams have put their lives on the line without hazard pay. Working with only scarce resources, our relentless efforts connected families to food, housing, medical care, diapers, mental health supports, at-home learning kits, and more, giving many families the only resources enabling them to successfully shelter in place. And it did not cost our county a dime. I am asking the Board of Supervisors to engage and listen to the wisdom of experienced community-based child care providers like Children's Paradise before spending $5 million. When ground zero child care voices are heard, comprehensive funding will be informed by practice, and therefore dollars spent will become radically more effective. It is time to make the people who care for San Diego's children and families the #1 investment priority on our CARES list of investment opportunities. Surely investments into child care and the amazing people who care for San Diego's children will create supports to get our economy moving quickly. These smart investments will also pay the ultimate dividend for generations.
Ma'am, I'm going to ask you to summarize your comments, please.
As children and families thrive because our funding priorities were organized efficiently. Thank you.
Thank you. Our next speaker is 9354.
Please enter the meeting password followed by #.
Hi, this is Ariane Batazzi from Carmel Mountain Preschool in San Diego, California, and I fully support essential workers being funded. I think one of the problems with that, though, is that all the essential workers aren't going to have places to bring their children because it's not financially feasible for preschools to operate with 10 children and 2 to 4 staff members. Even if that granting is in place, there's many preschools that are going to choose not to open because they can't stay in business, or who are going to go out of business with a limit of a 10-person group size. There's been multiple studies coming out saying that children are not the super spreaders that they were originally thought to be. I was at our pediatrician's office, Coast Pediatrics, on Thursday, and they let us know that children actually aren't the super spreaders that they're meant to be. And so a group size of 10 isn't going to change what's the health and safety of our staff members. I just think that we really need to rethink group sizes of 10 and the consistent, when you're going into an organization and reducing your group size by 20
5 to 30%, but increasing the amount of staff members that you need and increasing your staffing cost, it's just not feasible to stay in business. So what I'm asking is for you guys to make an exception for the group sizes and for us to operate our preschools to the best of our ability by implementing all the things that we've been implementing the last 3 months by staying in business. We haven't had any COVID cases at our preschool. We've stayed in business this entire time. We have been fully employing our staff, but it's getting to the point where it's not feasible to do that. So just asking you guys to relook at that if you guys want to keep childcare businesses in place. Thank you.
Thank you. Our next speaker is 9792.
Hi, my name is Sophia Haidari, and I'm with the organization Youth Will. Youth Will is also a part of the Invest in San Diego Families Coalition. Working families should have access to child care. Many essential workers are making the choice between keeping us safe and going to work or staying home to take care of the children. The coronavirus has impacted every facet of life, and we must recognize that child care is a critical component in our response and recovery from COVID-19. These workers have that is why I'm asking that the Board of Supervisors support emergency child care vouchers for COVID-19 essential workers and other vulnerable populations. These vouchers would provide immediate child care funding for essential workers, including healthcare and healthcare staff, social service workers, first responders, and those in the food supply chain. These workers have sacrificed and risked so much for us during these unprecedented times, and we should ensure that they can at least do their jobs without having to worry about whether or not their children are being taken care of. Thank you for your time, and thank you for your leadership during these difficult times.
Thank you. Our next speaker is 9997.
Hi there, this is Roberto Alcantar with the Chicano Federation of San Diego County. Thank you once again, supervisors, for having this forum for us to be able to share our thoughts on these issues. Childcare is such a critical need right now, particularly for a lot of our families that are lower income workers. We got farm workers out there without this option. And, as an organization that serves these families, we're hearing a lot from them that a lot of them are having to turn down work opportunities or having to turn down shifts and eventually losing their jobs just because they don't have access to childcare at the moment. And as many have mentioned, we did get the money from the state, but that simply wasn't enough. It ran out way too quickly. And what we're asking for here is a very, very modest amount for now to really help deal with this issue. But we really hope that this is the beginning towards longer term investments to ensure that all families who need childcare have access to that service here in San Diego County. Many of our workers, are putting themselves on the front line. They don't have the luxury of staying at home and working from home like some of us do. They have to put themselves out there. And the least we could do is ensure that their children are being taken care of in a safe and welcoming environment. And also, aside from providing slots, we also need to make sure that childcare providers are able to access the things that they need to provide a safety and healthy environment for children. This weekend, along with the YMCA and other organizations, we hosted cleaning supply kit hubs throughout San Diego County and gave out hundreds of supply kits for our providers. Those kits ran out almost instantly as soon as the email went out to let people know to sign up. So there is a huge need. So we hope that not only we're investing in ensuring that we have additional slots for our critical workers, especially our low-income workers, but also that our providers have access to the supplies that they need to provide a clean, healthy environment for our children. Thank you.
Thank you. Our next speaker is 7244.
Good afternoon. My name is Lindsay Wade, and I'm with the Hospital Association of San Diego and Imperial Counties. Before I continue, I want to first thank the Board of Supervisors for your incredible partnership with hospitals and health systems during these unprecedented times. We know that you stand ready to support our regional healthcare system whenever you can. The Hospital Association strongly supports the proposal to allocate $5 million of the county's CARES Act dollars allotment to provide emergency child care vouchers for COVID-19 essential workers. hospitals and health systems in San Diego County provide employment to approximately 70,000 people. As a result of school and child care closures, thousands of hospital employees need emergency child care. Over the short term, some families were able to patch together temporary solutions, but now with many schools not scheduled to open until fall, the need for emergency child care is even more critical. Our members have told us that a lack of affordable and accessible emergency child care will continue to have a critical impact on their health system's ability to meet operational needs. The urgent demand of emergency child care for essential workers was demonstrated clearly by what happened with the first set of vouchers released in late April. All were claimed in less than a week. And although the first allocation was a step forward, thousands of healthcare workers are still without any option for safe and affordable child care. Healthcare workers on the front lines fighting COVID-19 stepped up to meet the healthcare needs of our region. Please take action today to provide critically needed child care for their children while they provide healthcare for our community. Please vote yes in support of this proposal. Thank you for the opportunity to comment.
Thank you. Our next speaker is 7372.
Good afternoon, Honorable Board of Supervisors. My name is Tony Tosca, and I'm the Secretary Treasurer for San Diego City Firefighters Local 145. And I just, again, want to urge your support for this Essential Workers Child Care Initiative. We stand together with CAL FIRE Local 2881, SEIU United Healthcare Workers for this initiative. It's a critical time, essential time that we have some help. This is not sustainable. Although we do support the child care centers and their ability to take care of children, but there are limited options here. We don't have a lot of options, and this initiative does provide options for us to have people to come and care for our children at home. We don't have to juggle and also be the teacher, the essential worker, and the caretaker all in one swoop. This is not a full-time, a long-term. This is temporary, just to get us, to keep us sustainable, to keep us out there as essential workers to support the needs. Our firefighters and healthcare workers provide service countywide with several communities. We support operations during this crisis, and we continue to. So I'd just like to reiterate that we stand together, united on this issue. Essential workers need you. We call upon you. We're here for you. We'll continue to support you, and we just ask you to support this. Thank you very much for your time. And thank you again to Nathan Fletcher for your leadership and bring this issue to important. Thank you.
Thank you. Our next speaker is 1647. If you'd like to address the board on item 15, you can make your comments now, please.
Hello, good afternoon. My name is Nicole Stamps, and I'm calling from San Diego, California. I'm an essential worker working as a child care provider. I strongly urge you to vote yes in favor of the proposal for San Diego County's funding for child care vouchers for at-risk families and families for essential workers that are serving our communities. Thank you very much for allowing me to speak today. Stay safe and God bless you.
Thank you. And our final caller is 7187. If you'd like to address the board on item number 15, 7187.
Hi, I'm Jack Schaefer, President of the San Diego Police Officers Association. Our 1,800 plus members are on the front lines of the COVID-19 pandemic. While the SDPOA took steps to provide an emergency child care center, parents are hesitant for their kids to leave the safety of their homes. This funding provides critical in-home parent choice vouchers. The in-home aspect is vital in a health crisis, and we urge the Board of Supervisors to approve the funding. The members of the San Diego Police Officers Association are grateful for your consideration. Thank you.
Thank you. And that concludes public testimony on this item, Chairman Cox.
Very good. Well, as we get into board discussion, I want to commend Supervisor Fletcher for bringing this item forward. I think this is certainly an appropriate use of the CARES Act funding, and I think it will certainly help get all of our businesses back to work by having child care vouchers available. The one thing I would point out, and I would ask for Supervisor Fletcher's concurrence to add an additional recommendation. Obviously, the County of San Diego has been mentioned many times today is getting $334 million in CARE Act funding. And that money is going to be spread out over so many different costs that the county has incurred, including a lot more costs than we're anticipating in revenues. I would also point out that the city of San Diego is getting $249 million. Certainly the city of San Diego doesn't have the same public responsibilities in regards to public health and social services and the safety net programs that the county does. And I know that the city of San Diego will have a lot of discretion on how they will spend their $249 million. I would love to suggest that maybe we should make our money contingent upon the city of San Diego, but I'm afraid that they may not put the same priority, if you will, in regards to spending a portion of their funds on childcare services. My request of Supervisor Fletcher would be to add a recommendation that we draft a letter for the chairman's signature that would request the city of San Diego to match our $5 million to assist the citizens, certainly in the city of San Diego, and obviously our money is going to be available to anybody in the county. I don't want to necessarily track where the money is going, but I think clearly the city of San Diego is the biggest part of this region, and I believe they should have an obligation also to assist, including a lot of their own residents and employees that would benefit from this. So I would ask Supervisor Fletcher if he would be amenable to adding that as an additional recommendation.
Mr. Chairman, I had my hand up. I don't know if you see those when you.
I didn't. I apologize.
That's okay. Could I throw something out there too?
Okay.
A thought kind of along the same lines, but I have a long history of supporting childcare in our region almost from day one when I came into office, which was quite a while ago. And I've always been a strong proponent, and I understand more than ever now the lack of childcare and how it impacts our working families, particularly our essential workers. And as been stated by many of the speakers, that childcare is key to our region moving forward. And there never was a time like the moment to invest. And the vouchers support these essential workers so that they can support our community and the effort as we move forward. So while I appreciate Supervisor Fletcher bringing this proposal forward to make a contribution of $5 million, along the lines of your idea, but I would even be a little bit stronger in it, because $5 million is not going to go very, very far. And if we can double the money, $10 million, it's going to go a lot farther. And of all the cities in the county, the city of San Diego is the only city, as you just mentioned, that receives the CARE Act funding. So think of it this way, and maybe we give Supervisor Fletcher the choice, I don't know, but I think it is fair not just to make the request, but my amendment that I would request would require that the county's $5 million appropriation be contingent on a $5 million appropriation from the city of San Diego. And the reason that I think that that's important, I think we'll get the 10 million that way. If we just make the ask, I'm not sure. But this is a priority to us. It should be a priority for the city with the CARE Act money that we, each of us, county and city, receive. So I think it's reasonable to do that. And the speakers have made an excellent argument of why this is a priority for the funding. So that would be my request for an amendment.
All right, well, let's turn this into a toss-up question. We'll ask Supervisor Fletcher, would you like to have a contingency or a request?
Well, I think it's appropriate to have it be contingent upon it. I can't think of any better utilization of Federal CARES Act funding. The funding is designed to help us get through this pandemic. We know childcare is essential to workers being able to work. One thing we haven't talked nearly enough about as we talk about reopening our society is reopening opportunities for childcare. And so I think we know that there are available spots that are not able to be filled today. And it would certainly seem like a modest investment on our part, a modest investment on the city of San Diego's part. So I have no problem accepting that our $5 million will be contingent upon the city also contributing $5 million. That should get $10 million into the fund, which could help reach a whole lot more workers and help them when they need it most.
Okay, with that comment, I would certainly accept that as a seconder of the motion as an additional recommendation. Is there any further discussion?
Yes, I have a question, I guess, for staff. They said, you know, one of the callers said that there's not enough child care providers out there because of the restrictions on the facilities for some of these groups or companies that are out there running childcare. I heard all of the vouchers were claimed. Were all of the vouchers used, or are people able to, are they able to provide or find places that are willing to take their kids? I mean, if they got the money, are there enough facilities out there to provide that service? And I don't know if staff has that answer or knows if all of these vouchers were actually used last time.
Thank you, Supervisor Desmond. Our understanding is those vouchers were used up right away. Alethea from our first five is not in the chamber today, so I can't ask her that, but she has been point on this for the County of San Diego. So I will certainly have her track that down and get back to you right away. Dean, do you have anything to add on that? No. Okay. Thank you.
Okay. Well, I think it'd be, you know, if hopefully through today's earlier motions, if we do get some more local control from our governor, this might be something we will look into because we want to make sure there's enough, you know, places that are available that can, you know, take the kids as well. So I'll be supporting the motion with the contingency on there. I think that was a great idea, and thank you very much.
Okay. Is there any further discussion? Seeing none, I'll ask the clerk to please call the roll.
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Very good. Our last item on the agenda today for action is item 16, an air pollution control district item number 1. This was brought forward by Vice Chairman Jim Desmond and Supervisor Kristen Gaspar. So I'll give them an opportunity if they would like to say some introductory comments, starting with Vice Chairman Desmond.
Sure. I mean, do we have speakers on this item, or I didn't pull it? I don't know if somebody else.
I believe we had 5 speakers earlier. I'm not sure what the number is right now.
Okay.
We can find out.
Well, I'll just start if that's okay. I want to thank Supervisor Gaspar actually for docketing this item with us. Also want to thank Sarah Agassi and the entire Luge team for producing such a widespread memo, exploring ways to help our businesses most affected by the COVID-19 crisis. Many of our local businesses are struggling with the impact of the current crisis. We heard today from many of them. We've heard from hundreds of businesses about the current issues they face, and we as county leaders should be doing all we can to help our local businesses and that 25% unemployment rate. Today's action will provide a 6-month waiver to defer, not to excuse, 6-month waiver of fees for inspections associated with environmental health, agriculture weights and measures, plan checks for tenant improvements, and air pollution control permit renewals. Waivers of these fee types, we're going to help our local farmers, our restaurants, salons, kennels, manufacturers, and the medical industry out there. It's going to cost about $1.7 million of our general fund. But I've included in this as a recommendation to have staff look at using state and federal funds where possible to backfill this cost. We've heard from many business owners regarding their inability to pay their property leases due to impacted operations. Today's action will defer lease payments for tenants on county-owned land, such as county-owned airports, for 6 months. This could reduce our revenue stream by approximately $15 million, but it will be recouped once the deferral period is over and the tenants begin to pay back on their leases. Lastly, I want to have asked staff to look at creative ways to help with the restaurant industry once they are open for dining, including curbside service and pickup, maybe dining seats, and even in the parking lots. if possible. So I want to thank Supervisor Gaspar for your partnership in this. And I'll go ahead and make a motion to recommend item 16.
Okay, Supervisor Gaspar.
Thank you. I'll second the motion. Resilience is defined as the ability to become strong, healthy, or successful again after something bad happens. And 6 long weeks ago, I stood with several restaurant owners as we began to evaluate that something bad. Our health, businesses, and our livelihoods and way of life continue to be at risk as we face this pandemic. I've cried on the phone with small business owners who don't know when, if ever, they will reopen their doors. Obviously, our actions today will go a long way. And I've spent many sleepless nights trying to figure out if we can keep the doors open to my own business, a business that my husband and I have built from the ground up over several decades. We as Americans, as San Diegans, put our trust and faith in the medical community, and we've sacrificed and continue to sacrifice a lot to follow their advice. And in business, the best thing you can have is certainty. So today's actions give some level of certainty in an uncertain time. I want to thank Sarah Agassi and Mel Milstein and their staff for their expeditious work identifying the recommendations included in this memo, from streamlining and eliminating redundancies to deferring and waiving fees and permits. We can help get San Diego back to work. And this will help more than restaurants, farms, biotech, manufacturing, aerospace, hospitals, labs, and other medical facilities can all benefit from these recommendations. These recommendations are an investment, and we should be doing what we can as elected officials and as neighbors to get San Diego County moving as safely as possible. Thank you, Supervisor Desmond, for partnering on this item.
We'll go directly to the speakers at this time. I believe we have 3 speakers waiting to talk on this item.
Thank you, Mr. Chairman. And just to clarify that motion would include the recommendations under item 1 on the Air Pollution Control Board agenda.
Right.
We have 3 callers on the line ready to address the board, and I'll turn it over to Aaron to identify the first caller.
Thank you. Our first caller is 5557.
Thank you. My name is David Flores. I am the Air Quality Program Director for Environmental Health Coalition. As we move to reopen, let us continue to carefully balance COVID-19 impacts on human health as well as on businesses, and realize that there's a connection with our air quality and environment. The work of APCD is essential for safeguarding the air quality throughout the region. EHC supports fee deferral for facilities that need relief. At the same time, facilities that do not need this relief should not be accepted from paying fees that support protection of air quality for San Diegans. In addition, it is imperative that APCD be repaid from the general fund for losses and revenue in order to continue their essential work. We are told that large shipyards, for example, are considered essential and have not slowed down. Maritime businesses are operating at near or full capacity. These facilities are directly upwind of AB 617 Portside community. APCD is currently leading the development of the first community emissions reductions program that seeks to advance multi-million-dollar 5-year strategy to reduce emissions in the Portside neighborhoods of Barrio Logan, Logan Heights, and West National City. We applaud regulated facilities that have done the right thing for shelter in place and urge you to provide relief for them. But no fee exemption should be granted for facilities that have had little to no impact. We urge you also to allocate funds from the general fund to compensate for losses for fee revenues to APCD. Thank you for the opportunity to comment on this matter. Let us continue to protect the most vulnerable in our communities, and let's keep up upholding San Diego as a model with actions that provide responsible air quality protection. I wish all the moms out there a safe and happy Mother's Day, and thank you for all you do in protecting that next generation. Thank you.
Thank you. Our next speaker is 7359.
Hello, my name is Brian Epperson. My name is Brian Epperson, resident of San Marcos and CEO of Target River, an advertising agency that works with nearly 200 local businesses throughout San Diego County. I appreciate all of the supervisors' time and diligence today in addressing so many issues, including the one earlier today regarding accelerated efforts to support allowing businesses to open as they work through the reopen safety framework that was laid out and encourage our acceleration of that. on this matter, I am calling in support of it and the efforts to provide any financial relief for small businesses that are going to try to attempt to open back up. Unfortunately, it's not just to use an analogy that's been used often, a light switch that people can just flip back on if their business has been closed as it has been for many, many weeks. And so any support that could be offered in terms of fee reduction, acceleration of permit application approvals, or anything else that can be done to help stimulate things and help so many of the businesses that you have been hearing from would be greatly appreciated. Thank you very much.
Thank you. And our last caller is 9343.
Hi, this is Michelle Krug, Executive Board Member with the California Alliance of Retired Americans, CARA. First, I want to start off really applauding our County Board of Supervisors, particularly Greg Cox and Nathan Fletcher, for all of the balance and just stability and you have brought to this whole situation. And I particularly want to thank Nathan Fletcher's staff, Heidi and Nick, because when KPBS stopped broadcasting your press conferences, they were heroic in figuring out a way for me to still be able to get that really critical information for someone who is a shut-in and really dependent on all of the facts that you do bring out during those press conferences. I really do appreciate them. On this item, I couldn't agree more with the first speaker, so I don't need to repeat him. If the businesses do not need the deferment, I don't think they should get it, particularly like the shipbuilding companies. And because they've been working all along. And I do want to, again, I appreciate the consciousness of how your leadership has just been looking at the big picture. And all of the speakers that spoke in item one, not all of them, some of the people that spoke in item one, I just would ask them to look back at our history with the Spanish influenza and the ferociousness that pandemic came back across the world 2 more times because people let up too soon. So I just hope that people will keep that big picture consciousness so that we're not in that same predicament. Again, thank you for your leadership.
Thank you. And that concludes public testimony on this item.
And Mr. Chairman, I would note for the record that we received 3 e-comments on this item.
Very good.
Mr. Chairman?
Yes, Supervisor Jacob.
Thank you. First of all, I want to thank my 2 colleagues, Supervisor Jim Desmond and Supervisor Kristen Gaspar, for bringing this forward and initiating it. And it builds on what we did in March and will continue to assist our businesses. And I like the idea that there's small number in regards to the actual waiver of the fees, but most it would be a deferral. And we really don't know how many businesses will be taking advantage of this, but if it helps just a few businesses, it's well worth it. So, we'll find that out in the future. I'm in full support of the item, but I just have one question. And if you go to, it's 2E under business process streamlining, changes or waivers. And it's under, it says stay limited enforcement zoning ordinance. I mean, I don't have a problem with that, but under the little I in the 2 I's, where it talks about criteria, and I don't know, Jim, Kristen, if you want to answer this, their staff can answer it, but how will this criteria be developed? Will businesses that are affected in this be a part of the development of the criteria? That's one part of the question. Second part of the question, does the criteria belong in the zoning ordinance and in the recovery plan that we adopted in item number 1, both or one or the other? And I'm not sure. I know we want to develop that criteria. We want to do it in the right way. So those are my questions. Do we not?
I'm going to defer to staff on that as far as, how it's going to be done. I think we need that criteria sooner rather than later for the curbside pickup for dining establishments. How they're going to do it or where it's going to sit, I think you're right. It needs to probably be in both categories, in the recovery category and the code. But is someone there for staff can kind of answer the process that's going to take place for this?
And then how long is it going to take?
Supervisor Desmond and Supervisor Jacob, we, in Planning and Development Services, will be happy to coordinate with the businesses that would be impacted as it relates to the criteria. Certainly, the criteria could come back to the Board of Supervisors. We were trying to expedite this and have this accomplished at the staff level. And we would also be happy to work with the public health officer and the public health team to incorporate that in what was discussed as part of the prior item that we covered as it relates to the plan.
I'm not asking for it to come back to the board necessarily. I just want to make sure you're working with the business. I think we want to get the criteria developed as soon as possible. But Jim and Kristen, that would be more your call if you wanted it back to the board.
I don't think I need it back to the board. I trust the staff with this. This is in their wheelhouse, and I think I trust them to do the right thing.
Okay, is there any other discussion? I also would just like to add my thanks to Vice Chair Desmond and Supervisor Gaspar for bringing this item forward. I think this is another important step we can take to help businesses at least hopefully get back on their feet in a much quicker time frame. If there is no further discussion, then we will be voting on the motion to accept the recommendations. The motion was by Vice Chair Desmond, seconded by Supervisor Gaspar. Will the clerk please call the roll?
Thank you, Chairman Cox.
Aye.
Supervisor Jacob.
Aye.
Supervisor Gaspar.
Aye.
Supervisor Fletcher.
Fletcher, aye.
Vice Chairman Desmond.
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Well, very good. This has been a long meeting. I appreciate the public input. I appreciate my colleagues' cooperation in working through these virtual board meetings. In addition to being Supervisor Desmond's birthday, and I'm sure we could all join in unison and sing happy birthday to him, but Supervisor Desmond's shaking his head no. It is also Cinco de Mayo, and this coming Sunday is Mother's Day. So there's a lot of things to celebrate in addition to hopefully seeing a lot of our businesses beginning to reopen on Friday. And I think that's something that everybody's going to be excited to see. The only other item on our agenda today is closed session, and I would suggest that we will deal with closed session tomorrow after the land use hearing. And so if there's no further business to come before us today, we will stand adjourned until 9 a.m. on Wednesday, May 6th. This meeting is adjourned.
Bye.